Over 75% of our patients are diagnosed with late-stage disease on first clinical presentation. The diagnosis of ovarian cancer, especially at such a late stage, comes as a complete shock. There are no symptoms associated with the disease, and there is no accurate way of screening for ovarian cancer other than surgery. Because ovarian cancer is detected so late and it's in its advanced stages, it's quite often very difficult to treat. Survival rates are amongst the lowest of any of the cancers and have not changed over the last 30 years. Early detection is key to changing these survival statistics. Early detection is key to improving these survival rates for ovarian cancer patients. Over the last decade, we as a research community have made significant progress in understanding the complexity of ovarian cancer. We now understand that the disease is made up of multiple subtypes, and we're understanding a little bit more about how these subtypes of ovarian cancer behave. So now, equipped with this knowledge, we are focusing our research efforts into developing an early detection test for ovarian cancer, the treatment of recurrent disease, and also developing personalised therapies for ovarian cancer. Ovarian cancer survival rates have remained dismally low at 30% over the last couple of decades. We know that if we can detect the cancer in its earliest stages, we can increase these survival statistics to 90%. Due to the long-term funding support from the Ovarian Cancer Research Foundation, we're working on an exciting study called the Active Ratio test. This test aims to detect ovarian cancer in its earliest stages. We've identified a biomarker that's expressed during the earliest stages of ovarian cancer. We're hoping to implement this test much like the pap smear or the breast cancer screen, which have dramatically improved survival rates for these cancers. We are now progressing to a prospective trial using a group of women who are at risk of developing ovarian cancer. The intention is to ensure that this test will adequately and accurately detect ovarian cancer in its earliest stages in all women who present with the disease. Despite radical surgical and chemotherapeutic interventions, over 90% of our ovarian cancer patients will develop the disease again, and it's usually within 18 months. We want to give women the opportunity to live without fear of this disease coming back, and that's why I'm really excited to be involved in projects that are looking at preventing disease recurrence.
So ovarian cancer can come in many different forms and types. Apart from the more common epithelial type tumours, there are rarer forms of tumours which can actually be detected earlier. The problem for some of those tumours, however, is that they have a tendency to recur later on in life. And when they do recur, they come back very aggressive. My research here at the Hudson Institute looks at one of the more uncommon types of ovarian cancers known as granulosa cell tumours. We're aiming to try to understand why this disease, which can be detected earlier, tends to come back later on, and when it does come back very aggressively. So we're trying to understand the genetic and the protein changes that cause a primary tumour to become these aggressive recurrent tumours.
None of this would have been possible without your donations to the Ovarian Cancer Research Foundation, so thank you for your support.